We know that you're not a low priority nurse practitioner.
That's not what nurse practitioner recruiters do. We get you out of the stack. Get out of the stack.
You don't want to be in the stack.
No, stacks are bad. Today's topic is, what do nurse practitioner recruiters do for nurse practitioners? I'm Blake Mosier.
And I'm Aaron Dunn.
With medicalrecruiting.com, and we are nurse practitioner recruiters. So what is it that we do for you? Well, I can tell you one thing. We get you out of the stack. Get out of the stack.
You don't want to be in the stack.
No, stacks are bad.
What is the stack, Blake?
Yeah, well, you're not going to be found in the stack. See, you've probably applied to jobs online before, and most of those jobs have already been filled or are just duplicates of other jobs that you've already applied to. Mm-hmm. And after you've clicked on about 4 links to then get to what they call an applicant tracking system and fill out an application of like 2 pages, still not to know who's actually hiring, well, you get to the stack.
Yeah.
That's where you find the stack.
Yeah. You might have it might be an open job. They really need you to come join their team. But there's probably some frantic office manager that's actually responsible for making that first contact with you, but she's too busy. She can't.
Yeah.
Or they can't do it.
You apply, and they get an email, and that email sits in emails and
purgatory. Email purgatory.
Low priority into the stack.
We know that you're not a low priority nurse practitioner.
That's not what nurse practitioner recruiters do.
What do we do?
We care for you. We care for healthcare. And in fact, when you reach out to us, we know that you want a job. And we take that seriously. So we're not going to let it just sit in our inbox.
No, we're going to get you out of the stack.
We're going to talk with you about what it is that you need to be happy in your career and what you want in a practice setting, what your compensation requirements are, what kind of patient volume you want, where do you want to live, where do you want to practice, what matters to your family and the community that you live in. Those are the things that we want to know. Because we care about you. And you're not in the stack. See, in the stack, what happens, if you're lucky, the office manager hits print, and this resume gets printed and goes into the file folder with the stack. And it sits there until the doctor or the practice administrator looks at it, which, what do doctors do?
They see patients.
Yeah, they save lives. They're busy saving lives, treating patients. They don't look at resumes all day.
Right.
But I do.
Yeah, we do. We like seeing your resume.
We like save the resume. Save the resume.
Save the
yeah,
resume.
So it's not like saving the patient.
Exactly. What the doctor wants to see is patients, and then after they see patients, or if they need a provider, they want to talk to an actual person.
A person.
So as a nurse practitioner recruiter, what we do, we make a connection with you, the actual person, not the piece of paper that sits in a stack.
Cut through the noise.
We help you cut through the noise and get to the right person so you can actually have a good conversation with the person you're trying to get employed by.
It's like taking a direct flight to the decision maker when you're working with a recruiter. We're going to make sure that you're genuinely interested in the practice setting that we represent, and then we're going to cut through the noise, get you out of the stack, and into the hands of the right person.
Are you ready to advance your career? Call us.
medicalrecruiting.com. 888-812-3452.
Right on.